Welcome to my channel Primoltalks. This is Dr. Priyanka Bishnoi. In the previous lecture, we have covered gingival epithelium, and in this lecture, we will be covering gingival connective tissue, that is gingival fibers. So, let's get started. The connective tissue. Connective tissue of gingiva is also known as lamina propria. It has two layers, that is the papillary layer and the reticular layer. If you see this diagram here, this is your epithelium and this is your connective tissue. So the papillary layer, it is a layer which is just adjacent to the epithelium. You see, this is the epithelium here. Just adjacent to the epithelium is your papillary layer. This papillary layer, it is adjacent to the epithelium and is present between the retipex formed by the epithelium. Okay, the reticular layer, this is here is your reticular layer. This reticular layer, it is contiguous with the periosteum of alveolar bone. The connective tissue, it has two components, that is the cellular component and the extracellular component. The cellular component comprises of the fibroblast, macrophages and inflammatory cells. As you already know that the connective tissue, it has less amount of cells as compared to that of epithelium. So the fibroblast here, they will comprise only 5% of the connective tissue. Whereas the extracellular component, you will see large amount of fibers and ground substance. So these fibers, they will constitute 60% of the connective tissue. Here you will see three types of fibers. Okay, what are these three types? That is your collagen fibers, then is your reticular fibers, and third is your elastic fibers. Okay, so the collagen fibers, basically you will see two types of collagen fibers here. That is your type 1 collagen and the other one is the type 4 collagen. So this type 1 collagen, it will form the bulk of connective tissue and it will provide tensile strength to the gingiva. Now coming to this type 4 collagen, this type 4 will branch between these type 1 collagen bundles. The second type of fiber is the reticular fiber and the third one is the elastic fiber. This elastic fiber is further divided into three types, that is your oxytolin fibers, then is your eleunin fibers and the third one is the elastin fibers. So these three fibers, they are distributed among these collagen bundles. So the main function of these fibers is basically to provide strength to the gingival tissue. Now coming to the ground substance. This ground substance, it fills the space between these cells and fibers. So the space between the cells and the fibers is filled by your ground substance. It has increased amount of H2O content. Okay, increased amount of H2O content will be seen here, and you will see proteoglycans, okay, and glycoproteins in the ground substance, proteoglycans and glycoproteins. So which proteoglycans you will see here? That is your hyaluronic acid, and other one is the chondroitin sulfate. Okay, the glycoprotein that you will see here is the fibronectin. This fibronectin, what is the function of fibronectin? It will mediate the process of adhesion and migration and it will bind the fibroblast to the fibers. Then other protein that you will see here is the laminin protein. So as you already know, this laminin protein, it is found in the basal lamina and it attaches the connective tissue to the epithelial cells. So this was all about the cellular and extracellular component of connective tissue. Now we will discuss gingival fibers in detail. Okay, So let's first discuss the functions of gingival fibers. So what are the function of these gingival fibers? They brace the marginal gingiva firmly against the tooth. They provide rigidity to withstand the masticatory forces without being deflected away from the tooth surface. And they also unite the free marginal gingiva to the cementum of root and adjacent attached gingiva. Now we will discuss the groups of gingiva. So gingiva is basically gingival fibers. They are basically grouped into primary group of fibers and secondary group of fibers. So let's discuss the primary group of fibers. So there are basically 5 bundles of primary fibers. What are these 5 bundles? These are your dentogingival fibers. Dentogingival fibers. So here if you see in this diagram, they extend from the cementum to the crest of outer surface of your marginal gingiva. Okay, here you are seeing these fibers. They are extending from your cementum to the crest of marginal gingiva. What is their function? To provide support. That is, they attach gingiva to the tooth surface and they provide basically the support. The second group of fibers that we will discuss here is the alveolo-gingival fibers. So as the name suggests, these fibers, they extend from the periosteum of the alveolar bone to the crest of gingiva. And what is their function? They attach the gingiva to the alveolar bone. As you can see here, they are attaching this gingiva to the alveolar bone. So these are your alveolo-gingival fibers. Now the next group of fiber is the dentoperiosteal fibers. So these fibers, they extend near the CEJ. You see here near the CEJ. From here they extend into the periosteum of your alveolar bone and they protect the alveolar bone. So these are your dentoperiosteal fibers which extend from the CEJ to the periosteum of alveolar bone and they basically protect the alveolar bone. The fourth group of fibers that we will discuss here are the circular fibers. These small circles that you are seeing here, these are your circular fibers. These fibers, they surround the tooth in a ring-like fashion and they course through the connective tissue of marginal as well as your attached gingiva. Now the fifth group of fibers that we are going to discuss is the transeptal fibers. So these transeptal fibers, you see these fibers, they extend from cementum of one tooth to the cementum of neighboring tooth. You see from here they are extending from cementum of one tooth to cementum of the neighboring tooth. So what is their function? They protect the interproximal bone and maintain tooth to tooth contact. They maintain tooth to tooth contact and they will also protect this interproximal bone. So they extend from cementum of one gingiva to the other. So this was all about the primary group of fibers. Now let's come to the secondary group of fibers. So the secondary group of fibers, the first fiber is your periosteogingival fibers. They extend from periosteum of bone to the attached gingiva. Here you see they are extending from the periosteum of bone. These are your periosteogingival fibers. And what is their function? They attach gingiva to the alveolar bone. Okay, the gingiva is attached to the alveolar bone by the means of these fibers. That is your periosteogingival fibers. Now the second group of fibers is the interpapillary fibers. The interpapillary fibers. Here you see these fibers, these that I have marked with the yellow highlighter. This is your interpapillary fibers. So they extend from faciolingual direction and present in the interdental gingiva. You see they are present in the interdental gingiva. They extend from the faciolingual direction. And what is their function? To support the gingival tissue. They provide support to the gingival tissue. The third group of fiber is your transgingival fibers. So here you see these are your transgingival fibers. These fibers here, these fibers here, these are your transgingival fibers. So these fibers are in and around the teeth in attached gingiva. See, in and around the teeth these fibers are present and the function is to maintain the alignment of tooth in the arch. So they maintain the alignment of tooth in arch. See, these fibers, they are just going in and around the teeth in the attached gingiva. So these are your transgingival fibers. Now coming to the fourth group of fiber, that is your intercircular fibers. Here you see these fibers. These are your intercircular fibers. They extend from cementum on distal surface of teeth. So you see here, they are extending from the distal surface of the tooth. Okay. And fifth one is the intergingival fibers. So these intergingival fibers that you are seeing here, these fibers here, they are the intergingival fibers. They are present within the attached gingiva, and their function is to provide the stability and support to attached gingiva. So they are present in the attached gingiva and they provide stability and support to the attached gingiva. The sixth fiber is your semicircular fibers. Here you see these fibers, which these arise from the mesial surface of tooth to the distal surface of the tooth in a half circle. As you see, they are going around the tooth in a half circle from the mesial surface of the tooth to the distal surface of the tooth. So these are your semicircular fibers. The seventh group of fiber is the oxytocin fibers, which are present in all connective tissue. And eighth one is the elastin fibers, which are present in the connective tissue of gingiva and PDL. So this was all about the two group of fibers that we have discussed. That is the primary group of fibers and the secondary group of fibers, which provides strength to the gingiva. Now coming to the blood supply of gingiva. So gingiva is basically supplied by, number one, supraperiosteal arterioles. See, these arterioles that you are seeing here, they will provide blood supply to the gingiva. Second is the arterioles which emerge from the crest of interdental septa. You see these arterioles which are emerging from the crest of interdental septa, they also provide blood supply to the gingiva. And third is the vessels of the periodontal ligament. So only you have to remember these 3 points, that is the supraperiosteal arterioles, the arterioles emerging from the crest of interdental gingiva, and the vessels of periodontal ligament. These form the blood supply of gingiva. So this was all about gingiva. With this, we have come to the end of the topic gingiva. In the next lecture, I'll be covering periodontal ligament. So if you have any queries regarding gingiva, feel free to drop your comments in the comment section. Thank you for watching my videos. See you next time.